Director with Transamerica Agency Network, and I am so excited to be here with you this morning. This is such a great program, and I want to thank you for coming. I'm equally excited to introduce our speaker today. His name is Ed Stone, and I'll tell you, Ed is one of the leading long-term care specialists in the country. So we're in for a treat today. But that's the thing that excites me about Ed. The other things about him, that the long-term care is great, but I want to tell you something about him that I just found out that was just so cool. Ed was a 3-time NCAA All-American in track, was inducted into the Denison University Athletic Hall of Fame. I give you Ed Stone. Ed, take it away.
Thanks, David. Appreciate it. Good morning, everyone. It's a pleasure to talk with you. Enjoy your warm weather. I'm coming to you from 30 miles south of the Canadian border in northern Vermont, where we already have the leaves turned, and it was about 32 degrees yesterday morning. So enjoy the fact that it's warm down there in the Peach State. I wish I could be there with you. I work for Crump Insurance Services, as you may have read from my bio. I'm the external wholesaler for long-term care products. And of course, I do need to give the obligatory disclaimers. I'm not giving tax and legal advice today, though I will be talking a little bit about tax and legal issues. You as an advisor, unless you have the proper credentials, shouldn't be giving such advice to your clients. They should always verify everything you and I tell them with their particular legal and tax advisors. So what's going on today in the long-term care world? Well, there's this thing called COVID-19 out there. You probably have heard about it. It's been in all the papers. It's having an impact, obviously, on all types of financial services companies, especially the insurance industry. The life insurance carriers are scrambling very quickly to make sure that the potential mortality impact on their bottom line is managed. It hasn't avoided long-term care carriers as well. At Crump, we work with about 8 or 10 different long-term care carriers, and every one of them over the past 3 or 4 months have either stopped writing people over a certain age for a while, or have required anybody that hasn't had a physical recently to go get physicals, etc. So it has had an impact. Over the last few weeks, though, we're starting to see the reins loosen up a little bit. People are now going back to writing over age 70 clients and reducing some of the restrictions out there. But what's really killing the long-term care industry, and honestly the financial services in totally, is this massively long, prolonged, low interest rate environment. That's why you're seeing all of the repricing in life insurance products, long-term care products, annuity products, disability income products. They're all being affected because the companies can't make enough money to put money aside for the reserves. So it doesn't have anything in long-term care, I think, to do with claims experience. We kind of have the claims, data under control now in the long-term care world. But what you're seeing is the result of a lot of things outside the control of the insurance carriers. Yes, a lot of the old products were poorly poorly priced. So a lot of those old blocks of long-term care business are, experiencing significant in-force rate increases. I worked for a couple of the major carriers for 20 years and got the pleasure of sitting in the rooms with actuaries, day after day, listening to them talk about how smart they were. Well, sorry guys, they kind of blew it. So the newer products, though, are priced appropriately. So if you're not selling long-term care because you think it's something that is going to blow up in your face, feel very comfortable knowing that they understand now the problems that have been out there in terms of bad pricing, persistency, underwriting problems, etc. And they've corrected that, and they've baked into those new products what should have been in the pricing of the old products. Of course, we're all doing virtual selling now. I'm calling from my home in Vermont. I've been locked up here for almost 6 months, going stir crazy, like many of you, I'm sure. I always like to start my presentation with the, with the quote you see on your screen from, you may have heard of this woman, I think she's from your neck of the woods, Rosalind Carter, of course. Former First Lady said this back in 1997. I've been using this quote ever since. There really are 4 kinds of people in this world: those that have been, currently are, will be, or will need caregivers. I've been a caregiver. Mom and dad lived in our house for 5 years. I'm currently doing long distance caregiving. And at my young age of 67, based upon my aforementioned athletic career and other things, I'm pretty sure I'll need some care because my body's falling apart. So I have long-term care insurance in place as part of my plan. Feel free to use this quote. It's not copyrighted or anything. I think it's something that you should send out to all your clients, age 40 and above, to start the conversation. Why people need care, of course, living longer. If you live long enough, stuff's going to break down. But you know what? The biggest concern today is not the broken hip, it's the broken brain. Cognitive issues are driving the long-term care underwriter teams crazy. Probably bad choice of words, right? They're really concerned because with the fact that people are living longer, they're healthy enough to live, but if the brain goes, they need the care. So when you talk to your clients about this, they may say, well, I tried to get life insurance and I got turned down. Well, life insurance and long-term care underwriting are totally different. So make sure they understand that you can go to a source, a Crump or whoever out there, you can go to them and, talk to all the carriers, pre-screen your clients. Many times what people thought would disqualify them because they didn't get life insurance can still get them long-term care insurance. We know that long-term care, I'm not going to get too deep into this, but we know it's basically to protect your clients were they unable to do 2 of their 6 activities of daily living. By the way, this PowerPoint will be available with all the slides, so feel free to reach out to your association and get that. They've standardized how these claims are paid since 1996. 2 of 6 ADLs or a cognitive assessment, cognitive condition gets your clients their money. Please don't think that long-term care companies are finding ways to beat people out of claims. Very, very small percentage of claims are declined, and usually those are because they don't fit the 90-day requirement. So long-term care is not an acute situation. It's something that's chronic. We're also finding the cost of nursing homes accelerating. But folks, my advice to you, if you're talking about this subject, is stay away from talking about nursing homes. Nobody wanted to talk about that before January 1st. Nobody definitely wants to talk about it now. Your care is given in the home. First and foremost, the vast majority of claims, 2/3 of the money being spent today or being paid today for claims is for home care. So talk with your clients about anti-nursing home planning. That's what I do all the time, is talk to clients about staying out of the nursing home because nobody wants to go there, especially as I said now. But you can see the cost of home care is going up dramatically. And the ability to find home care workers is shrinking. So if your clients have a long-term care policy in place, they're going to have the resources available to pay for this care to stay home as long as possible. You can get your care at home, adult daycare, assisted living, hospice care, or of course the dreaded nursing home. But focus the conversation on staying out of the nursing home, making sure your clients understand that all the care services that used to be required to go to facilities to get are coming to home. We're doing it right here. Virtual caregiving is becoming very, very much a big part of it. We call them care bots, where you have a robot type thing in your house with a screen and all, and it's programmed to ask you at 10 o'clock if you took your medicine. If you don't answer it, call somebody. It reminds you to have food. Somebody programs in your doctor's appointment, so you make sure that you're ready to go to your doctor's appointment when the car service or what is coming to get you, etc. So focus on home care. You're going to get a lot better reception to open the conversation from your clients than talking about going to the nursing home. The impact of care is dramatic on families. It tears families apart. I've got 5 siblings, and I'll talk to 2 of them after my mom and dad passed away because of, the way they treated me and my wife when we took our parents in. We just don't want anything to do with them anymore. So talk about the impact on the family. You'll have a lot more success in getting people to consider this. It is a very stressful thing. It does create problems in the family. It does affect the caregiver's well-being themselves. And of course, the ability to keep a second marriage, comfortable between the 2 different families can really be impacted if one of the parents is getting long-term care and the stepchildren think that, they're using up all their mom or dad's, money that should have gone to them, etc. So be very careful and focus on the families. And I think you'll feel a lot more. Talk about care coordination, guys. This is a built-in feature. Every family doesn't know what to do. And if they know that with a long-term care insurance policy, at the end of the phone is a care coordinator, a nurse, a psychologist, a social worker, government relations type of person. All the companies have this, and it's free. It helps the families in a time of crisis. The financial considerations of trying to self-insure this problem, come on, it's going to cost you $100,000 a year right now for care. What's it going to cost your 60-year-old client? What's it going to cost them in 20, 25 years? Nobody has that kind of money sitting around. And especially if you've invested, buy low, sell high. If you think taxes are going to go down over the next 25 years, then you're probably cognitively impaired. You better get your insurance in place before they actually formally designate you as cognitively impaired. The tax situation is only going to eat up the money that people think they can set aside to pay for this. Timing of liquidation of assets, another issue. Liquidity, a big issue. What are your clients' assets in? Real estate, businesses, long-term portfolios. If they've got to liquidate stuff quickly, they could take a massive hit. So try to look and try and tell the story to your clients about the impact of this on their family, on their financial well-being, on all the other considerations that they have to do if they think they can self-insure this problem. And folks, just a bit of a disclaimer. I thought I had an hour's time, so I'm going through this stuff kind of quickly, trying to get what I think are the highlights. So please bear with me, okay? Here are the cost of care. In the Georgia area, these are pretty accurate costs of care. All of the carriers have a current calculator that you can go to see the cost of care in Georgia. Or perhaps your clients are going to retire to South Florida or Arizona or Northern Vermont. You can plug in there and see what the cost of care is today in those areas so you can plan accordingly. Everybody thinks the government's going to pay for this. Guys, the government isn't set up to pay for this. Please don't let your clients use that as an excuse not to have a planning conversation. Medicare and Medicaid are not designed for chronic illnesses. Plus, you got 77 million baby boomers heading into this program. We're going to bankrupt it by the time we get done with this thing. Plus, if you are a Medicaid patient, if you've ever had to deal with Medicaid, it's not a fun system. I'm not knocking it. I'm just saying it's not a fun system. Plus, if your clients want to be Medicaid eligible, they basically have to spend down all their assets. And that means that all the things they plan to do with their money is not going to be able to occur because they had to use it to pay for their care. There's a look back of 5 years. If your clients try and shield their assets, the state of Georgia and the feds will come in and look back 5 years to make sure they didn't just give it away. And finally, there's a state recovery. You may not even know about this, so let me explain what it is. If your client runs up a bill on the state of Georgia's Medicaid system, when they pass away, of course, all of their assets transfer to their spouse, but when the spouse passes away, that bill that your clients ran up on the state of Georgia's Medicaid program, that $300,000, $400,000, $500,000, the state of Georgia gets to step in first and get that money. So all the greedy kids that thought they're going to get that $500,000 that dad had, sorry kids, the state of Georgia gets it first because your dad ran up a $500,000 Medicaid bill. So folks, Medicare and Medicaid went in force in 1965. The average life expectancy back then was about 70. It wasn't designed for this massive amount of people who are living into their 80s and 90s and accessing Medicare and Medicaid. I'm not saying the programs aren't there. I'm just saying let's educate the public that this isn't the way to go. You better have a plan, and insurance makes a lot of sense. And finally, for your veterans out there, I sincerely thank you for your service, but the VA is not set up for this either. They're good at doing the acute things, the operations, the well care and that sort of thing, but the VA simply says the only way we will even consider you for long-term care reimbursement is if what your problem was related to your service. So if you're a veteran, but you just got old and sick, etc., it wasn't related to your time of service, a war injury, etc., they're not going to pay for long-term care. There's a lot of misconceptions. So please get educated on it. Work with David, work with our team. We're happy to help you understand that. Here's a big point for you guys because you work in the health industry and you're doing a lot of group health. I don't know if you know it or not, but HSA money can be used to pay for long-term care. You can certainly tell your clients that if they want to beat Uncle Sam a little bit, put money in their HSA, get that deduction, pull money out of the HSA income tax free to pay for long-term care policies. And those long-term care policies, when they go on claim, even though they paid for it with HSA money, the benefits are income tax free. I don't measure my patriotism by the size of the check I send the geniuses in Washington and Montpelier every year. I love to send them as little as possible. So using my HSA is one way I accomplish that. Linked benefit products are becoming incredibly important out there. It's really flipped. I'd say about 90% of the sales today are linked benefit. The other 10% are traditional long-term care. Used to be opposite. Link benefits solve the issue about live, die, or quit. These are life insurance-based products or annuity-based products. They really are designed to be long-term care products, not life insurance. I mean, there's a death benefit, or if it's an annuity, there's a pass-through, you know, at death. But they really are designed to provide your clients the maximum long-term care, but also hedge their bet in case they die and never use it, or they don't use all of it, or if for some strange reason they wanted to cash out down the line, it's a life insurance policy base. So they could pull money out, have a death benefit, but also have plenty of long-term care. So there's a lot of opportunities in the hybrid space. The traditional long-term care policies are the ones that you probably have seen or maybe have sold in your career. Those are more like renting the insurance. If you die and never use them, yeah, with a couple of exceptions on certain riders, if you die and never use it, you know, you didn't get anything for it. Now, it's a less expensive way. You use the same amount of money, you're going to get more traditional long-term care than linked benefit because you're not buying life insurance in a cash accumulation vehicle. So there's a number of ways that you can go at this marketplace from a solution standpoint. But my advice is it's 98% people knowledge, 2% product. Don't reverse it. Don't focus so much on the product until you understand what the people are about. And then you come to your GA or wherever and you find the right solution for them. So asset-based long-term care, as I said, is life insurance. You can go up to age 85. There's carriers out there that will underwrite up to Table 8 underwriting. You can do single pay. You can do 10 pay. You can do 1035 exchanges from old life contracts, 1035 exchanges from old annuity contracts. You can even use qualified monies to purchase these products with. There's ways to do that. You know, contact David. We'll be happy. I'm sure he'll be happy to explain some of those things to you. So it's a great opportunity to find that lazy money that probably would be liquidated for long-term care if they were to need it, and utilize that to leverage that money to more benefit if they needed long-term care. Who buys those products? A lot of people. People with assets, people that are trying to self-insure the risk, people who can't get traditional long-term care through underwriting might be able to get through the mortality underwriting of a linked benefit product. All they're doing is taking assets and repositioning. That's all this conversation is about. So we did talk about live, die, or quit. That's what the linked benefit products provide your clients. Here's some of the leading carriers, not an advertisement for them. I'm just saying these are the top guys out there that are selling the linked benefit products. In the traditional marketplace, you have half a dozen really good carriers out there. Transamerica, David's company, Mutual of Omaha, National Guardian Life. You know, there's a whole bunch of carriers out there still selling traditional. These are your leading guys in the linked benefit space. You've taken your proper CEs. You got to have an 8-hour CE class first to sell long-term care. If you don't have the 8 hours, you have to take it first before you can even talk about it. And you have to talk about underwriting, guys. Long-term care underwriting is actually easier. It's actually easier in terms of the requirements than life insurance underwriting. So if your clients are concerned about blood and urine and physicals and stuff, long-term care doesn't ask for that stuff. There's an interview, they do a cognitive screen on the telephone interview, etc. Long-term care underwriting is not a quick process either. It's going to take anywhere from 6 weeks or longer to get medical records, to do the telephone interviews, to get all the data together. So your clients should be having these conversations sooner than later. 45 to 65 is the opportune marketplace for this. The average issue age right now is about 58. So this is not a retiree product anymore conversation. This is the baby boom conversation, especially the 50-year-old who's dealing with mom and dad right now, in their 80s. Mortality versus morbidity underwriting. Like I said, there's things that you can't get life insurance underwritten for that you can get long-term care underwritten for. Cancer survivors, they can get long-term care, guys. May not be able to get life insurance, but they can get long-term care. Diabetes, may not be able to get life insurance, they can get long-term care. But also, don't assume because your client got life insurance issued that they can get long-term care. Arthritis doesn't scare a mortality underwriter because you don't die from it, generally speaking. Morbidity underwriters are scared to death of arthritis because of the inability to do 2 of your 6 activities, right? So pre-screen your clients before you get too far into it, okay? Let me just go past these because there's an area here that I really want you guys to see, because you're in the benefit area, many of you, and what you don't know is the federal government is your best friend. No, I haven't been drinking this early in the morning, folks. The federal government is your best friend when it comes to helping your business owner clients use their corporate checkbook to purchase long-term care for themselves. Your business owner can use his or her money to buy personal policies for themselves, for key executives. It's a tax deductible situation. They can set it up with return of premium or life insurance so their company's money is not wasted. The reason we can do this, back in 1996, you may have heard of this bill. It was called HIPAA. It's called HIPAA. You may run into it now and then, right? Well, we all can't stand all the restrictions of HIPAA, but I'll tell you one thing, they put a whole section in there on long-term care that is the biggest gift to your business owner clients that the feds have ever given them. The ability to use their corporate money to purchase long-term care on a deductible, discriminatory, income tax-free basis. And if you don't use it, you didn't waste your money. It doesn't matter if your clients are a C Corp or non-C Corp. It is a deductible premium. There's just different ways you have to go through it. It doesn't matter if it's an S Corp. They can buy it on themselves. They can buy it on their employees. Here's something you may not have known. The Fed said, if you use your corporate money, David, for long-term care, you don't have to worry about that 10% adjusted gross income test that you have to do to get a medical deduction if you're using your personal checkbook. Guys, I'm telling you, this is a wide open market. We have carriers that will give reduced, not guarantee issue. Get those words out of your mind. Guarantee issue does not exist anymore in the long-term care space. But we have carriers that can get you down to simplified issue underwriting, that can give unisex rates for couples. Family members can take part in the programs. You can do 10 pays, you can do single pays, you can use HSA money to pay for it, etc. If you have business owner clients, you need to reach out to someone like David so he can help you find the right way to approach this. If you're working in that marketplace and you want to cross-sell, do off-cycle enrollments, because we refuse to do these during the open enrollment. It's a waste of time. But if you're looking for off-cycle business, a way to have more opportunity to talk to more people in your group settings about other issues, long-term care is the door opener, guys. It truly, truly is. It's right there in the tax code. If I was doing this, and by the way, if you know accountants, I'm happy to do these presentations for accounting firms. I do it all the time. The feds have made it really easy, guys, to do this. Section 162 bonuses, those work with the linked benefit products. That's perfectly fine as well. So guys, all I'm trying to do in this accelerated, I just ran 100 meters instead of a mile. All I'm trying to get you guys to see is this market's still wide open. More importantly, your clients need this conversation. I'm going to tell you that you're leaving yourself wide open for an E&O suit if you're talking about all kinds of insurance and you don't bring up the conversation on long-term care. So David, that's my story. I'm sticking to it. I don't know if we can take any questions or anything, type them in or call, come off of mute or whatever. But if not, you know how to get a hold of us.
That's great. Ed, thanks a lot for that presentation. That was outstanding. And I'm sure we learned a lot. I'm sure the people who took part in this learned a lot this morning. And again, we're there to help them. Ed and I can help you in any way that you need to make sure you understand what's going on in this world and take advantage for your clients, because I know that's what you're all about. So thank you so much for being a part of this today. Ed, thanks a lot for such an outstanding presentation. I know you had to run, you remind me of your track days, man, when you're All-American. So, you were ready for this. So that's good stuff. Great.
Yeah,
so
my knees are killing me. My knees are killing me.
Great, good deal. So with that said, I guess we're out, Gina. Are there questions, or do we take questions, or are we're good?
Anybody want to, if you have the little chat button, you can type in questions there and we can see them. If you have any chat button, let me do this. Let me put my contact information there. If you want to send me a question, I'm more than happy to do this. Let me change this thing right here to all panelists and attendees. You can reach me at this email address. I'll be happy to talk with you about any of the things that I went through. Oops, if I can type. Boy, it's murder getting old, folks, when you got to look through your bifocals, you know? There we go, at rump.com. I think that says it. Yep, there we go. Okay, there's my email address, guys. If you look in the chat box, it should pop up on the screen. Feel free to reach out to me with your contact information if you want to have a continuing conversation about anything that I shared with you here today, okay?
I also like to take a minute to thank my marketing director for being on with us, IDAP Marketing. It's Daphne registered there. Thanks Daphne for being on with us to make sure that I'm on time. So I appreciate her being a part of this program today. Jana, with that said, guy, is there any other questions or anything else for Ed?
No? Okay, well.
Well, good deal. Well, we're going to sign out. Ed, any last minute? Cliff McKnight has a hand raised.
Yes. Someone has a hand raised? Let's see.
Clifton McKnight has a hand raised.
Well, let's see. Do we have anything in the chat box? I don't see questions in the chat box.
Let's see.
If you have a question, it's edward.stone@crump.com. Shoot it over to me. I'm sitting in the office today. I'll be happy to respond back to you. Send you anything you need in terms of documentation, all that kind of stuff. Have the conversation, folks. We need to have this conversation with all of our clients, because the good news is we're living a longer, healthier life. The bad news, we're living a longer, healthier life. We're going to need this care at some point in time, many of us. Thanks for your time today, guys. Greatly appreciate it.
Thanks a lot.